Hello, everybody. Good afternoon, good morning, or good evening, depending on where you are joining us from. My name is Tamsin Rose, and I'm the Senior Fellow for Health at the Africa-Europe Foundation. Welcome to this conversation this afternoon, an Africa-Europe Alliance for Health, Pandemic Resilience and the Future of Healthcare. We're delighted to invite you into this conversation this afternoon, and we have an amazing range of speakers who are going to share their insights. But just to give you a sense of what we're going to be covering this afternoon, in December we launched the strategy groups for the Africa-Europe Foundation as we launched our first work. We've had a health strategy group which has been very active over the last 6 months, where we've been exploring the priorities, the challenges. We've issued 2 statements on equity of vaccines, because that clearly emerged as an issue of great importance. This is our first opportunity to share with a broader audience some of our conversations, some of our insights and ideas where we see there's more work to be done. And of course, as the Africa-Europe Foundation, we're interested in the 2 continents together. We're interested in exploring what we can do if we can leverage the strengths of the 2 continents. If in a global context, what do Africa and Europe have in common? How do they build their shared values into a program that delivers sustainable development and health and well-being for both continents? And I will be introducing an amazing range of speakers to you, but just to give you a sense of how we're going to operate, please use the hashtag Africa-Europe Foundation if you're on social media. We encourage you to interact with us using the chat. Please feel free to put messages, comments, questions. We'll be monitoring them, and I'll be bringing in the audience into our conversation. I'm delighted to pass to the first of our 2 co-chairs right now to give us some insight into both the political priority that the Africa-Europe Foundation lays on health and where we see this going. So Professor Agnes Binagwaho from Rwanda, she is the former Minister of Health, and she is going to be sharing some of the insights of our strategy group so far. Good morning, good afternoon, Agnes. How are you?
I'm fine, and today I tell you good morning because I'm in Boston for 2-3 days. So thank you, Tasmin, for the welcome, and I want to give a warm greeting to all who have joined us today for today's session on pandemic resilience and the future of healthcare. As a co-chair of the Health Strategy Group, along with Gunilla, we are working together with all the members of the Health Strategy Group on the sense of urgency for Africa and for Europe to come together, with health being the center pillar of this partnership, using the following 3 sub-pillars. First, strategic autonomy in global supply chain for equitable access to treatment, quality care, and health products, including vaccine. And we totally understand that it's not overnight that we are creating the capacity for a continent to produce vaccine, but it's now that we need to accelerate the movement to be one day able to do that, for being ready to contribute to the world knowledge and world production to fight the next pandemic. But today, we are also going to talk about the fact that points across the world who could produce vaccine should produce more for the people to stop dying or to prevent death. The second, it's human resource in healthcare, of which we will need to increase access to education and production of quality resource in both continents, but especially in Africa, because we need, we are very, we don't have the capacity, we don't have the numbers, and we don't have the knowledge and the research capacity for handling the situation where we are now. Even if so far Africa have done well, we are facing a 3rd wave, and we don't know where it will lead us. The third sub-pillar is creating a new paradigm for public health that involves building community and social capital. With these three areas of interest and with the overarching goal to build a new foundation of Europe and Africa relation, not only post-coronavirus, but for resilience of future health threats, I have no doubt that the work we are all doing together with in our strategic group, and we are going to share with you, and we hope really you are going to enrich. All this will contribute greatly to leverage health on both continents, and this high-level dialogue that we are going to enter in a few minutes will serve as an interactive discussion and bring great insight for many prominent leaders in our strategic group and in Africa Europe Foundation at large. Thank you. Back to you, Tasmin.
Thank you very much, Agnes, and for giving some insight into some of the very lively conversations we've been having inside our strategy group. Let me pass now the floor to our other co-chair, Gunilla Carlsson, who has been working at global level for a number of years as a former minister from Sweden and is the vice chair of the strategy committee for the Global Fund. Gunilla, good afternoon.
Good afternoon, and thanks to all for joining. I just want to echo Agnes. We are having a hectic time ahead of us, and also what we have learned, that health now as an investment in individuals and also nations do matters. And I think from a European perspective, no other issue could be more useful to work on together, but we need to be more honest. We have to be much better on providing the right resources at the right time, continue to work on human rights and gender perspectives, but also to learn from each other. So beside what Agnes just spoke about, we also have a lot to incorporate in how we have first line of responders, how we can utilize communities, and to make sure that health workforce is something that is not only high-level professionals in a well-functioning system, including research and manufacturing, but also that we have health embedded in our societies on a scale that we perhaps not yet have had, because it's not only about illness, it's also about well-being. So there, I think it's a lot of inspiration coming now, but also that we today will learn more about how to finance health and to put it in the right perspective in order to provide for growth, equitable growth. So over to you.
Thank you very much, Gunilla. And as you say, equity is a core theme that runs through the Africa-Europe Foundation, equity within the continents and between the two continents. And I think equity has been put to test in the last 18 months as never before. And I'm delighted to introduce our next speaker, Kristalina Georgieva, who is the Managing Director of the International Monetary Fund, and of course, no stranger to us here in Europe, having been a commissioner at the European Commission with responsibility for budget, so finance clearly in your DNA. Congratulations, first of all, on the results of the voting on Friday, the new special drawing rights. Very exciting to see the global financial institutions having a chance to step up to help with resilience. But of course, developed countries have access to the greatest proportion of the SDRs. And yet the impact of the pandemic socially, economically, and health-wise is falling much more heavily on Africa and developed countries. What can you do inside the IMF to try and shift this balance? And what can we, as the Africa-Europe Foundation, do to help you to create some space to allow that shift to happen?
Thank you very much for the invitation. Congratulations for the birth of the Africa-Europe Foundation. Could have not come at a more important moment when what we see is a very genuine risk of Africa's development to be pushed back by a decade, by the pandemic, and by the fact that we seem to be coming out of it in two tracks, mostly because countries have different capacity to respond, but also because we have two tracks vaccinations. And unless we overcome this, we would be in a world that is less equal and less stable. And of course, we would lose people for no good reason. So for us at the fund, it has been an overarching priority to not only raise our voice on this dangerous divergence and what can be done about it, but also to raise money so we can play our part in it. And before I get to the SDRs, I just want to brief everybody that we have stepped up enormously with our existing concessional lending capacity for Africa. We have provided in 1 year 13 times more than we would do in an average year in the previous decade. With the special drawing rights, we will provide an injection of reserves and liquidity to all our members. I want to recognize that the African countries would get their share. Low-income countries as a whole would receive $33 billion injection. This is not trivial, but as you rightly said, we are in a situation in which countries with strong reserve positions that do not so much need an injection of reserves at this time will get a disproportionately large share. So what can be done? First, in 2020, we paved the way of what can be done because we called on our wealthier members to lend some of their SDRs so we can do this increase in concessional lending. And I'm proud to say that we got $24 billion additional capacity, concessional lending capacity. 2/3 of this came from on-lending special drawing rights. So we have a dry run, and the dry run has proven that this is possible and it is desirable. So where does that take us? To create opportunities to do more of this and to do it possibly with higher impact. We intend to increase our concessional capacity in our existing poverty reduction and growth trust. We have been talking to members willing to do so to on-lend SDRs, and I believe somewhere between $25 and $35 billion could be injected quite quickly, and that can turn into investment in health systems in countries that need it, fighting the pandemic. But we want to do more. We want to create additional capacity for building resilience and for integrating the notion of sustainable recovery in the work of the fund. And therefore, we are discussing with our members possibly creating what we currently call resilience and sustainability trust, where we can make use of this SDRs. They're willing, those that have it but don't need it are willing to supply for longer term maturity, higher concessionality investment. And you can be sure that we are prioritizing health among those. Let me finish with 2 points. One, today we must make sure that the pandemic is a front line objective in our collective effort, that we take this seriously. It is a war. And I can tell you that together with the WHO, WTO, and the World Bank, we at the IMF are creating the equivalent of a war room so we can push hard in a coordinated manner to get money where it is most needed, to get vaccines where they're most needed, and to get support for countries that most need it. And Africa, unfortunately, is seeing this third wave hitting hard. But also that we have to be creative. Some years ago, the world came up with IFIM, a way to issue a bond to vaccinate the world's children faster. And that bond issuance played such an important role for so many kids around the world to have better health and better opportunities. We have to apply that same creativity, and we at the fund are very seriously thinking how we can make the SDRs a triple win. A win as countries get their share, a win as we create on-lending capacity, a win as we innovate for making sure that we do our utmost best for all our members, and in particular for Africa.
Thank you very much, Kristalina. It sounds like there is true leadership happening amongst the international institutions and the extent to which they're seeing the convergence of their values and the direction of travel, which is financing put at the service of society goals. You talked about the Resilience and Sustainability Trust, you talked about the SDGs. We're really starting to sound like there is a message that the instant financing mechanisms are there to help countries meet the big societal challenges. And you've talked about a war room being created and that we're in a war against the virus. I know that Dr. Tedros from the WHO has already said the next pandemic is already here. It's antimicrobial resistance. So, is this war room going to be extended to other aspects of health, particularly, with things like AMR, which just like this pandemic affects everyone? Or is this the war room just for the pandemic?
We are starting, understandably, zeroing in on the pandemic that is with us right now. But we embrace wholeheartedly what is now clear, that pandemic preparedness and prevention are cheaper and most effective. And so you can expect to see us building that strength of collaboration and taking it forward in the spirit of the Independent Panel for Pandemic Preparedness and Response that Ellen Johnson-Sirleaf and Helen Clark chaired. So while our task today is to urgently mobilize $50 billion to bring the pandemic to an end, you can be sure that we would take this longer-term outlook.
Thank you very much for that. Let me now bring in the next speaker on my panel. That is Sarah Mbui and now Anyang Agbor, the Africa Union Commissioner for Human Rights, Science and Technology. Because we'd like to get some comments from your side about this important political shift and the extent to which Africa is becoming more visible and more powerful in global conversations. And in the area you're responsible for around human resources and science, we heard from Professor Agnes about the critical importance of Africa having the science capacity, the research capacity, and the pipeline of young professionals to help develop a response. Can you share with us some of the things that you're doing within the Africa Union on this area?
Thank you very much. Her Excellency Gunilla, the co-chair of the African Europe Foundation Strategy Group on Health, and the Vice Chair of the Strategic Committee, Excellency Raptam, His Excellency Raptam Lamara, African Union High Representative for Silence in the Guns, and former Minister of Foreign Affairs of Algeria, Professor Agnes Binagwaho, co-chair of the African Europe Foundation Strategic Group on Health, Honorable Ana Gomez, former member of the European Parliament, Ms. Kristalina Georgieva, the Managing Director of the International Monetary Fund, Honorable Chrysoula Zacharopoulou, member of the European Parliament. Distinguished guests, Excellencies, ladies and gentlemen, I'm delighted to be virtually here with you on this very important occasion of the first forum of the Africa Europe Foundation, and I have the honor on behalf of the African Union Commission to express support for this meeting. I will also extend the greetings of His Excellency Dr. Musa Faki Mahamat, the chairperson of the African Union Commission. I thank the organizers for inviting African Union Commission to be part of this webinar, particularly because health is at the center of our well-being. Indeed, congratulations for the African Europe Foundation Strategic Group on Health. Africa and Europe has come a long way in ensuring the well-being of our citizens through joint efforts, and I am pleased to reiterate that the African Union Commission is committed to our various partnerships to address common contemporary challenges. Speaking of health alliance, pandemic resilience, and the future of healthcare in both continents, there can never be a better time than now in these unprecedented times. With the outbreak of COVID-19, its associated new variants and its costly impact, it has become obvious that no single country can successfully fight a pandemic such as this. However, the COVID-19 crisis has created opportunities for change, opportunities to engage more, opportunities to explore unexploited areas, and opportunities to think of resilience in all sectors. So the experience of COVID-19 came in a manner that led the whole world look as if they were sleeping. The world was taken unawares that even the most powerful nations of the world were helpless. It caused an unprecedented impact on nations' economy, people's life, families, and communities, claiming lives of millions of people. And today, as we speak, close to 3.9 million persons have died globally. Imagine if we were prepared.
I apologize. I think we've lost the connection. We're going to move to our next speaker, and if we get Sarah Agbor back, we will, of course, bring her in. Let me now introduce Stanislav Raščan, the State Secretary from the Ministry of Foreign Affairs of Slovenia, who is in the coming days about to take over the rotating presidency of the European Union. I'd like to invite you to share some insights. Europe, of course, has its own agenda and lots of issues to deal with. How do you see, over the coming months, the important relationship with Africa building, and how Europe and Africa can come together to deliver a response on the pandemic?
Thank you very much, Chair. So let me say at first that I'm glad that cooperation with Africa has gained political relevance in recent years, also in the EU, and that one of the EU's top priorities is to build stronger, more ambitious, and a modern partnership with Africa. 2021 is a pivotal year for the relations between our two continents, marked by the preparation of the new comprehensive EU strategy with Africa, finalization of the post-Cotonou process, and the preparation of the 6th EU African Union, European Union Summit. The African Union EU Summit, which will now take place, it seems, in the first part of 2022, during the French presidency of the European Union, will provide an opportunity for the EU and African Union to renew their partnership and identify new cooperation priorities. Let me stress that also our trio, so trio of EU, of Germany, Portugal and Slovenia is in preparation of this African Union, European Union Summit. The COVID-19, of course, pandemic continues to present an unprecedented challenges for the whole society. It has left the most vulnerable even further behind. It has resulted in many negative impacts of human development. The COVID-19 shows that strong, inclusive, equitable, and resilient health systems are prerequisite for human, social, and economical development. It has demonstrated that addressing health inequalities and taking into account social determinations in assessing health is paramount to assure health for all. Nobody is safe until everyone is safe. Indeed, it is more urgent than ever to integrate water, sanitation, and hygiene into longer-term health systems, strengthening as foundation for universal health coverage and global health security. The COVID-19 pandemic relevant global gaps in the health system and basic services required for people to be able to protect themselves against the spread of the virus. As the WHO and governmental agencies recommended regular hand washing as a critical preventive measure against COVID-19, 3 billion people worldwide lack access to soap and water at home to do so. Good hygiene is the first line of defense against COVID-19 and essential to a resilient health system, and public health is impossible without clean water and soap. Finally, the sanitary crisis also showed that global health research and innovation plays a crucial role in preventing and responding to epidemic. In the future, EU-Africa partnership aims at achieving sustainable development in both continents. A strong cooperation in the health sector is paramount importance. Such cooperation should have a rights-based approach at the core. It should aim at supporting the capacity of countries to strengthen health system by including communities and investing in key sectors that are essential to achieving universal health coverage, such as primary health care, water, sanitation, hygiene, and sexual and reproductive health and rights, also in the light of the consequences of the COVID-19 pandemic. Additionally, the partnership should aim at the scaling up global health research and innovation collaboration, which is critical to tackle the current pandemic, as well as ongoing epidemic in poverty-related disease like HIV, AIDS, tuberculosis, malaria, and the growing threat of antimicrobial resistance. In this framework, a new comprehensive EU-AU collaboration on global health issues in all aspects will be needed. One of the focus of our presidency in the next 6 months will be human development, which is closely linked to the pandemic and its impact. For this reason, we plan to highlight water through different aspects of human development, as for an example of the opening event of 9 July, Health and Water of the Core of EU-Africa Partnership. We also just recently held an annual Africa Day International Conference in end of May that addressed, together with our African partners, the EU-Africa collaboration on access to clean water for all, including issues related to the COVID-19 pandemic. COVAX, together with Team Europe approach, is doing a remarkable part in ensuring that developing countries are not left behind. Slovenia itself is responding with financial and in-kind assistance. An additional meaningful contribution to COVAX is currently in the pipeline. Although major progress has been made with COVID-19 vaccination, there remains a serious imbalance of the global distribution of vaccines, with Africa having vaccines sufficient for less than 1% of the population of the continent. And finally, the situation in last year and half has shown us that it's important to show solidarity with each other more than ever. Vaccine sharing should be at the forefront, but we also should not forget about the resilience building, preventive action, and ensuring the access to basic social services, including WASH. As presidency, we intend to put this highly on our agenda. Thank you very much.
Thank you very much for giving us some insight into how you're going to be leading the European Council work over the next 6 months. And I note both the focus on sanitation, hygiene and water, and also on human development. And that will be something we'll be picking up in our conversation when we look at areas around workforce development, for example. If we're able to perhaps bring back Sarah Agbor from the Africa Union, I think the connection was re-established. If not, we'll
Sorry about that.
Yes, hello, lovely to have you back.
Okay, thank you very much. I will just continue from where I stopped so I don't waste more time. So where are we and what are we doing? Taking the case of COVID-19 at the African Union, efforts are needed for rapid research and development and innovation responses, policies and programs to boost R&D activities in 3 key areas: diagnosis and testing, 2, therapeutic and treatment, and 3, vaccines and local production of personal protective equipment, medical supplies, and looking inwards to explore the use of our rich biodiversity and traditional medicine. So health alliances in these various areas of need will add up to coping with any pandemic. This is the right time to form that global health alliance that will help us build the desired pandemic resilience to avoid the mistakes of COVID-19 that took us unawares. At the level of the African Union, we are also building a health alliance with all member states through a high-level African ministerial dialogue that facilitates consensus on various sectoral response to COVID-19. And at the level of the EU-Africa cooperation in 2020, with the efforts to build resilience to shocks and strengthen Africa-EU cooperation in the face of COVID-19 pandemic, the first AU-EU Ministerial High-Level Policy Dialogue was held on 18 June 2020. At this meeting, both sides agreed to refocus the partnership to deliver on COVID-19 by addressing the human health impacts and social effects of COVID-19 and economic recovery through a set of interventions on public health, green transition, innovation and technology, and capacities for science, which include open science, science advice for policy, as well as gender and human capital development. As we speak, I am aware that various programs have been initiated by both sides for implementation. As I round up my statement, I must reiterate the need for preparedness to future pandemics through partnerships and through international financing. We need to explore the various unconventional areas and experiences that may have stood out during COVID-19, including the yet unexploited rich biodiversity, engaging national stakeholders, and investing more on research on Africa traditional medicine. As my tenure as a Commissioner for Education, Science, Technology, and Innovation ends later this year, I take this great opportunity to thank the European Union for the unwavering support, not only to my department, but also for many more programs in the Commission. And I hope their cooperation through this platform continues to build a desired, resilient world. The name of the department was changed from Human Resources, Science and Technology to Education, Science and Technology and Innovation this year, 2021, during the Head of State and Government Summit. Thank you very much. I appreciate it.
Thank you very much. And I'm glad we were able to get you back after there was a technical gap. Let me now bring in somebody else to share some insight. I'd like to introduce Zeinab Badawi, who is the chair of the Royal Africa Society, a broadcaster and a member of the high-level group of the Africa-Europe Foundation, and on the advisory board of Afrobarometer. The foundation was set up to try and develop new narratives between Africa and Europe, continents which share so much history, some positive, some troubled. And if you reflect on the last 18 months of COVID, which has changed everything and nothing in many ways, we're now sort of taking stock after 6 months of our conversation. To what extent do you think the world has changed? The key leadership positions have changed. You know, how are things different from your perspective from 6 months to a year ago?
Thank you very much indeed, and lovely to hear everybody speak, and excellencies, ladies and gentlemen. Yes, I think that actually, for me, that the COVID crisis has very much, I hope, reignited a debate that we should be having about Africa's relationship with Europe. And I think that we need to reframe the way that we have been talking about the relationship. So one aspect of the relationship relates to the vaccine discussion we've been having. We know that Africa represents over 16% of the global population, and yet it is home to only 0.1%, less than that, of vaccine production facilities. And this has been exposed, of course, as we talk about vaccine apartheid, vaccine inequity, and so on. But that's really been a situation that's been like that for a long time. We saw how long it took for Africa to get the HIV antiretroviral drugs, 10 years after everybody else. So I think there is a reawakening now on the continent that Africa can't just be, constantly out with its begging bowl, waiting for, vaccines to come its way. So I would hope that the European Union, which has said that it plans to back production on the continent in Rwanda, Senegal, South Africa, and Egypt, that it really, really does bring this alive and really puts its resources. We've heard about patent waivers and so on, but it's got to have the technology transfer, the know-how, the skills and so on to really make that happen. So that's one aspect of the relationship that I think has to be reimagined. I think secondly, also one reimagining of the narrative is that, look, it's not a one-way street. Africa has more experience when it comes to handling epidemics or pandemics than anywhere in the world. You know, Africa is where 70% of pathogens with pandemic potential emerge. But really, African scientists have been left out of this debate. When you look at the African genomes, you know, they're the oldest, the most diverse. How much could we learn? The whole world could learn about how to survive infectious diseases from that diversity. So when you see that the mapping of the entire human genome started, you know, in 2003, but it remains very incomplete because the vast majority of it is still European, and genetic material from people of African descent makes up just 2%. You can see that this is really not wise, that Europe should act in a way of enlightened self-interest to say, actually, this lack of African genetic material constitutes a significant obstacle to understanding how everybody's bodies and diseases function. And so I think we need to have a debate that re-engages and brings in African scientists. We're seeing that already with the H3 Africa program, which is being supported by the National Institutes of Health in the United States, also the Wellcome Trust here in the UK. But where is the European Union in that? And there are many scientists who are working in the continent who are saying, look, we're carrying out groundbreaking research on the genetic causes of all sorts of illnesses and other afflictions. And I think the European Union really needs to center itself you know, in that debate, in those efforts. And then I think the third way that the European Union and Africa should engage on this matter, which has been exposed by the COVID debate, is something that we've talked about at the African Europe Women Leaders Network. And we want to reframe the conversation not only about compassion, solidarity and cooperation, but also about recompense. Because when you see how African health professionals, doctors and nurses work, you know, in countries in Europe, treating COVID patients and all the rest of it to the detriment of their own people, we can see that this is actually in violation of the World Health Organization's protocol on not recruiting from low and middle income countries. And this has gone up in the last few years. We actually heard calls for active recruitment from Africa to come and work in Europe to help with the COVID pandemic. And I think we've got to look at how Europe and Africa can engage in a debate on recompense for this, because, you know, it's the cost, the training costs, but also the wider opportunity costs of, you know, lost clinical training, research and policy expertise to these source countries. And we talked at the Women Health Leaders Network about, for every one medical professional who goes to work in Europe, we could perhaps have a training of 2 health professionals back in Africa. So I think that you know, the European Union, the African Union, this foundation could talk about things like creating an African Science Foundation, picking up on what Commissioner Sarah was saying. So I think that for me, with the various hats that I wear, this talk about a new global health architecture, vaccine access and covering that last mile has really got to reimagine the relationship in so many ways between the Africans and Europeans. And just to say, you know, we've got to really put the African scientist center stage, because there are some brilliant, brilliant people working. And I think researchers, academics, drug companies and startups all around the world are waking up to the potential that Africa offers in this area. And I think we've got to move from that model where researchers from the north go and study African people, take specimens and then go back to the global north to then tell Africans about the diseases that afflict them and so on. It's still, global health, I think, is still very much rooted and practiced in a way which is reminiscent of the old colonial system. So we need to build research capacity on the continent, and to use this foundation to really make sure we're seen truly as partners.
Thank you very much, Zeinab, really giving us some perspective on how the foundation has helped to generate new conversations and where we need to keep moving the dialogue further and reframe it. I'd like to introduce now Chrysoula Zacharopoulou, who's a member of the European Parliament and a co-chair of the strategy groups for our foundation, as well as being the vice chair of the Development Committee at the European Parliament. Chrysoula, can I invite you to just give us some perspective of how this dialogue between the two continents has changed and how health has been the catalyst for changing the way that people talk about it and increasing the urgency of addressing that relationship?
Okay. Yes, hello, thank you very much. Very happy to be with you. And of course, I listen carefully all the speakers, and it is the time of action, I believe. First of all, I'd like to say that as I'm a doctor, I always thought that the biggest investment is a healthy population. And we saw also today the economists, they understood that a healthy population can increase the GDP. So everybody now is convinced that the priority of all the countries is the health issues. So this was the first thing that this pandemic teach to everybody. Of course, I heard somebody that who spoke about public health. This is what I'd like to see between EU and Africa. I am very happy of this European model that is a public health model. And I'd like to see something, of course, that will be created by the African people, but that can permit the access to universal coverage and can also create an access to health to everybody. This is a moment where the health infrastructures, but also what Zeinab said, it is important that we create a networking between the scientists and between doctors and nurses from the two continents. And as a draft person for the EU-Africa strategy of the European Parliament, I had the occasion to travel and to visit, to see 8 different countries in Africa. And what I observed and what everybody said is that the African doctors, they have to stay in Africa. So I believe that in this new partnership, the European, we have to go, it is up to us to go now to Africa and to work with them. And this is a different way to see our partnership. I'd like to say also that as co-chair of Shareholder Council of COVAX, I'm totally, I totally make a call to everybody regarding the vaccination and the importance of sharing doses. But it's not enough. It is the moment that we have to help our friends to increase their production capacity. It is not normal that a continent of 1.3 billion of people produce only 1% of the vaccine. For me, it is unacceptable. So yes, this is what we do. President Macron, he did a strong commitment, as we saw a few days ago, with France support and the European support for the establishment of the first RNA messenger vaccine production and training center in Africa. The next week, I'm going to go with the Team Europe to the Pasteur Institute in Dakar. So that means that this partnership, it is true, it is happening. So we have many things to learn from each other. And of course, I'd like to finish with the new presidency. And as our minister said, the water, the sanitation, the menstrual hygiene, all of these are very important issues. And I believe that we have to work together. We have so much things to learn from each other. And this is the moment that European Union has absolutely helped Africa to find its own sovereignty in health matters. Thank you very much.
Thank you very much, Chrysoula. And let's now focus a little bit on what we've been doing inside the Health Strategy Group, because we've been discussing for a while this issue about our health workforce. And the fact is, we are, with the projections, we can see that we are short about 18 million health workforce for Africa. And this by 2030, and this needs to be filled. I'm going to invite Sharan Burrow from the General Secretary for the International Trade Union Confederation, because this is a global issue. The most mobile workers in the world, the people who are most likely to have moved to another country, are health and social care workers. And the movement is largely from poorer countries to richer countries. And now this has been highlighted by Zeinab as being a deeply unethical trend, and it is a subsidy that goes from poorer countries to richer countries, an unequal country. So we have in our conversation in the strategy group talked about creating an observatory that would allow us to analyze and project the future needs of health systems in both Europe and Africa, and develop a pipeline, a training process, so that both continents can meet their needs without poaching from each other. From the perspective of the trade unions, how do you see this movement of health professionals from one part of the world to the other, and how do we rebalance it?
So first of all, there has to be a commitment to actually investing in health, and the workforce is a large part of that. But you've heard Zeinab and others also on the capacity for manufacturing, for healthcare more broadly, because we all know that COVID-19 exposed the tragedy of underfunding health, and I would argue other care sectors, childcare, aged care, education. It exposed the dependency on indeed some of our lowest paid workers, mostly women, despite their skills in these areas, and the short-sighted human and economic vaccine impact of vaccine nationalism alongside of it. So you take the deficiencies in a robust health system and indeed vaccine nationalism, and it says it all about the lack of care and commitment to indeed people first. So you're right about jobs, decent work in care. This has three outcomes. One is, of course, if we actually filled that 18 million gap, and I suspect that's an underestimate. We know that certainly globally, there are something like 80 million teachers needed. The majority are indeed in Africa. So if you actually take the deficit, whatever it is, in that care, and in that part of the care economy, and remember, a lot of the jobs in care are hidden. They're obscured by informality. They don't have a formal contract of employment. And then if you look at the skills deficits, for the reason that indeed you just outlined, that as fast as African institutions train workers, they're often poached because developed economies don't want to spend money on training and recruitment of healthcare workers. And the compensation for indeed that skills training is just not there for African nations. So on a number of fronts, we have to invest, again, generally in full employment. And a large part of that is care. But it's not just about jobs and the quality of care. It's also that we know when you employ women in the labour market, this is the fastest multiplier in terms of impact on growth. So this is a win-win for the economy and indeed for people, but they're also good jobs. They're skilled jobs for women when the deficit of women's participation in the labour market is so great. So you get a win-win-win outcome. On the question of vaccine nationalism, can I just support what Zeinab said? If you don't share IP, but also the technology sharing that goes along with the recipe, and you don't actually provide the support for manufacturing in terms of skills and qualified staff, then it isn't just about, indeed, supporting Africa or the other areas of the continent where vaccines of the world where vaccines not produced. It's actually about protecting everybody, because it is a war, as Kristalina said, and no one is safe until everyone is safe. And indeed, while the next pandemic might be already here, we need to have a resilience against future shocks. I was also struck by Zeinab's plea to understand the expertise that exists, and indeed the depth of genome research that can be actually carried out by Africans from African experience, along with some of the traditional medicine understandings that indeed you heard before that. So we have to look at health from a holistic point of view. Of course, I'm absolutely focused on the workforce, but I know if those workplaces aren't safe, then that's not going to work either. And if they're not funded, they won't provide a resilience or indeed a security of work. We need more than this, though. We also need the social protection, so vital for resilience. And that means fiscal space. When we talk about social protection floors, then health and income support are at the centre. There is more, but they're at the centre of a dignity of survival and indeed of care support. And I want to commend Kristalina's leadership. When we asked her, with indeed the unions and the International Chamber of Commerce, asked her to support debt relief, she was there before us, but she vocalised that, the special drawing rights, the emergency funding, the trust funds you heard about, ahead of everything else. Here is a leader who understands and wants to work with other leaders, particularly women in development, and we certainly need that in the midst of the multilateral reform of trade, of development that must provide for a justice in recovery and resilience that we haven't seen to date. Finally, can I say to you, we have a broken labour market. When you have 40% of the world's workers only with a formal contract of employment, and even a third of those in increasingly insecure or precarious work, that leaves 60% of workers informal. And they dominate the African continent, not exclusively, but the numbers are there. That just simply means without social protection, without minimum living wages or income, then it's a day-to-day survival challenge. It's desperation, it's dehumanising, and we can do better than that. So we need a new social contract to rebuild the labour market. And very quickly, it has 5 central demands that are at the heart of Goal 8 of the SDGs. And when you marry that with Goals 3 and 4 and 5, and indeed 10 based on inequality and reducing inequality, with 1, we get a package deal. So those 5 demands are clear: jobs, jobs and jobs. Reinvest in full employment everywhere. And at the centre of that is not just climate-friendly jobs, critical, and the infrastructure and the technology sharing for that, but jobs in the care economy, and healthcare's at the forefront. We also need to invest in rights, human rights and labour rights. We cannot accept dehumanising exploitation in our global system. We need universal social protection, and we need a global funding support for the poorest of countries to establish those systems. We've done the research. It not only returns equal or greater amounts to the economy, it creates both a basic economy and resilience. And of course, we need equality of income, but also of gender and race. We must have an inclusive future, and the SDGs, the Paris Climate Agreement, require multilateral reform if we're actually to see the kind of future we want. I can only thank the foundation. I've been privileged to be part of a few conversations between the Women's Network, and it is absolutely enlightening to hear what indeed women themselves on the ground want as priorities, and we should be backing them right in there to have justice through work and indeed investment in the very things that put people, planet and prosperity at the heart of a new and just development model.
Thank you very much, Sharan, for reminding us again, just how much of the world functions on an informal economy, and that we've seen this with COVID, the extent to which people were able to isolate or stay at home was limited by the contracts, the social protection that they were offered. And again, highlighting that Africa is a continent with a lot of informal work. It's also a young continent, so it's an area where there's huge potential to invest in human capital development. I think what we wanted to do when we explored this issue of the Health Observatory is we recognized that modern health systems are made up of people, but not just the traditional health workforce that we recognize, doctor, nurse, pharmacist, but genetic counselor, drone mechanician, data scientists, visualization, patient coordinators. There's a whole range of skill sets that are needed, and to develop a pipeline to train enough of them and support them is the first step that needs to be put in place. So the observatory, as we've conceived it through the foundation, is one that is a future-looking, an observatory to look 10, 15 years from now. What kind of health systems do we want? Strongly digital, more patient-centered, more decentralized, interoperable. What skills do the people need who work in it, and then how do we develop them in a way that is equitable? Recognizing that much of healthcare is highly gendered, a lot of women working in the sort of lower ends of it, poorly paid, and at the top ends it's different. So all of these different issues need to be recognized. We've got some really good content coming in the chat. Thank you for those who've added elements, and I note that Achiri Emmanuel's particularly put links to papers he's written that will be useful for people to look at, looking at the Europe-Africa relationship. On this issue of the health workforce, I know we have members of the strategy group who are on this call and who are heavily involved in that. We have two people who've raised their hands. Achiri, you have your hand up, and Adamou, I think you also have your hand up. If you'd like to unmute in 2 minutes, if you can, briefly. Start with Achiri.
All right. Thank you very much. It's really been a pleasure listening to all the speakers today. I think that all of the speakers have raised really pertinent issues regarding Africa-EU relationship, in particular vis-a-vis COVID-19. I'm Emmanuel Achiri. I'm a PhD candidate of international relations, focusing on refugees, but also on the EU-Africa partnership, and I've published a paper on it. And I think that the comments of Zeinab and Sharan kind of re-echoed the problematic which we raised in this paper in terms of that the Africa-EU partnership needs to be reimagined. And the European Union over the last 60 years has been saying the right things, but has not been doing the right things. And in order to see a future partnership of equals, this asymmetrical relationship needs to be sorted out. And I think that COVID-19, more than everything, has shown how this asymmetrical relationship is very problematic, not only in healthcare, but for the future of the African continent. I just wanted to put out that statement, but I have a question which I'm hoping could be answered. All of the speakers have spoken about the EU-Africa relationship regarding COVID-19 and what would happen post-pandemic healthcare. But a lot of the time when we talk about COVID-19 and healthcare, we do not talk about refugees, the healthcare of refugees. And I think that that is something which is quite important. Africa has close to 26 to 30% of refugees worldwide. And so far, the response to the problems of refugees regarding COVID-19, or how COVID-19 has affected refugees, has been ignored in many aspects. And this is very problematic, especially because one, Some of the gaps include responding to the needs of refugees in camps, the fact that the majority of refugees are also women and children who are more vulnerable, also the fact that refugees do not have access to public health information, and very importantly, that refugees need to be part of the decision-making process when it comes to their healthcare. And I feel like a lot of the time when we talk about COVID-19 and healthcare, we also need to talk about the healthcare of refugees, because they are the most vulnerable group. And a lot of the time we do not include them in this conversation, but it would be important to integrate them at the decision-making phases, not only in terms of empathy towards refugees. So thank you.
Thank you for that and raising this very important point. We have in the health group discussed the issue of refugees, both within Africa and in Europe, both what they offer in terms of human capital and resources, but also the need to make sure that their health systems are accessible and appropriate for them. I just want to recognize that in the chat we had Peter Munene, who's a member of our strategy group, who highlighted the role of faith groups and community leaders within Africa, who will be playing a key role precisely in responding on some of those points that Achiri has just mentioned. Adamou, you had raised your hand. Would you like to give us a brief statement?
Yes, thank you very much, and thank you for really involving us in this very important discussion. I just want to raise some key issues. You know, when you're talking about the resilience, it's very important to consider some key aspects. That is the origin of this pandemic, the issue of mutation, which create a lot of variant, and also the issue of the solution coming from particularly the nature. So I think the environmental dimension, the environmental aspects of this pandemic is not, I didn't hear it very much coming from the different discussion on our panelists, and which I think if we really want to build resilience, we have to consider the issue of the origin of this pandemic and the issue of mutation, which is very linked to the environmental condition. And particularly in Africa, where the system and the community are very much vulnerable to the climate change, to the changing condition of the environment, it's very, very important to consider when building solution for long-term solution for the response to the pandemic. And I do hope, as Zeinab mentioned it in our speech, that is very, very, very important to consider it in the global scientific platform that will really address this kind of the issue, link health and the environment. And I hope the EU presidency that is going to start to also make it as one of the key points for consideration. Thank you so much.
Thank you for that. And yes, critical issue to make the link between biodiversity, the environment and health, because the risk of future pandemics is very clear if we can't address this issue. And I note that the World Health Organization will be holding a conference in November linked to COP26, looking at health and the environment and climate change, and we would seek to participate in that. And we have also highlighted the issue of One Health in the strategy groups. I note in our chat we've also had a comment from the AIM, the International Association of Health Mutuals and Sickness Funds, pointing to their position paper, highlighting how if you have social protection, it can be delivered through mutual programs there, and this is cost efficient, effective and equitable, and a solution for these areas where you have large numbers of people in informal protection. So I suggest that people follow that link. Peter, would you like to, I see that you've raised your hand. I'd like to give you the chance to be our last speaker in this section before we move to the last block of conversation around financing health and health bonds. Peter, please go ahead.
Thank you very much, Josephine, and all those that are participating. I just want to make a note, especially to the incoming EU presidency, that there is a note that was made in the statement that Dr. Raščan made, that he is happy to see that Africa has gained political recognition, And now by EU, and there is recognition of the political relevance of Africa in engagement on issues health. I just want to make one note so that possibly, because this might not be very known, that in provision of health services, about between 30 and 70% in some instances of health services are provided by faith community. And as the Africa gains political relevance, we hope that the faith community also will gain equal relevance, because there is no way that the faith community can be left in the engagement on issues discussing health, discussing how health can be provided, yet if they control or if they offer 60 to 70% of health services and own 60 to 70% in some instances of health facilities, where all these health services, including vaccines, will be provided, how that can be possible. So I think it's very, very important that they are brought onto the table. I don't know whether there is a mechanism that currently exists on how to engage with the faith community, but I would imagine that just like the way there is now political relevance in terms of recognition and heightened political relevance of the African governments and Africa as a continent, the faith community as a key player in provision of health services needs to also gain the same relevance. Thank you.
Thank you for that, Peter. And obviously, I think we would rely on you to bring your network in when we have the conversation about the future health observatory, because if we're looking at the health and social care workforce of the future, and so much of it is currently provided by the faith networks, they need to have a clear role in helping to define in the health and social networks of the future, what skill sets, how we develop it, how we support people in this network. So I think you will be a key player in the conversation that we're going to have next. And I'd like to close off this conversation that we're having about the observatory that we're going to develop, looking at the future needs of both continents. And I emphasize on this, that both continents have a shortage of health and care workers. Both continents are in the process of digitization and transforming the way they deliver health and care to use digital tools. And it's important that the path is together and not divergent, that one continent does not benefit while the other one loses out. And this is why we're developing a shared vision about what are the skill sets that will be needed and how we could develop them in a mutual way. And I'd like to invite our co-chair, Agnes, to close this conversation, because of course you have a key position as leading the University for Global Health Equity. So training the health workforce for the future, I know, is close to your heart. Perhaps you'd like to add a comment on why this observatory is so important.
So thank you, Tasmin. And I really enjoyed the conversation on the important issue. And the workforce is absolutely necessary as we are talking about creating a resilient health system. But we need also, as some of the speakers have said, to combat the hypocrisy. In one hand, to say that the Europeans are supporting Africa to build this workforce, and the other hand, to empty the continent purposely, because I can show you some advertisement for nurses and doctors to come to work in Europe in the middle of the pandemic, leaving Africa alone. So in one hand, take their best brain and hand-skilled people for Europe. It doesn't solve the problem of Europe, it increases the problem of Africa. And in 2016, the cost was more than 4 billion. What is more than the support the Europeans were giving? So creating an observatory will help to see and map what we need to grow to create the resilient health system we plan to have. And a resilient health system is also with the capacity to manufacture what we need, to not be seated and wait that the world will give us what is remaining when they have been served. So creating the workforce that work in clinical service, the workforce that produce the clinical tool we need, the workforce that is there also for education for health. And of course, here we are talking about health, but it's relevant for other sectors as well. So this observatory will help countries to plan what is needed.
I'm saying I am taking on, we take the vaccine.
And also, sorry, I thought it was me, but also, so to build, to plan what is needed, to plan education for this, to plan also the employment, the future employment of this workforce we need, and also to make the rich countries accountable when they are stealing those brains. Because when it's a football game, a football transfer, you pay those who have educated. When it's a workforce, a person in a profession in Africa, you just take it. So these are the mission we will give, and others. We have to work together to see how to make it relevant for all of us.
Thank you for that, Agnes. And again, you mentioned footballers, and it's because footballers are seen as talent. And we treat talent with care. Talent is paid for. We recognize that talent is trained and identified, and we need to see our health workforce in exactly the same way, and to make sure that we have a proper human resources development program that talks about decent terms and conditions, training pathways, career mechanisms, and that both continents can collaborate. We're about to move to our last segment, where we're going to look at what are the financing mechanisms that we could use. And one of the areas that we're starting a new conversation with in the foundation is we're looking at the idea of health bonds. These would be specific mechanisms that allow money to be allocated for health. As a reminder that there are only about 15 African countries that have met the Abuja Declaration goals of self-financing and putting money into their own health systems. The pandemic is going to limit the ability of countries to put money in health in the future because of the other challenges they're facing. So we need a new financing mechanism. We heard at the beginning from Kristalina from the World Bank and the IMF how much is being put at global level. But we want to talk about, is it possible to create a new financing mechanism, a health bond, that would allow countries to raise funds, perhaps at lower interest rates over longer periods of time, to allow them to make the investment in healthcare that's transparent, accountable, and has local ownership? We have somebody from the European Investment Bank who's going to be able to share her experience. Maria Shaw-Barragan is going to tell us a little bit more about their experience, because they've been trying out specific bonds linked to health, to education, and the SDGs. So let's hear from her some of her experience and how this might work. And just, it's great that people have been putting things in the chat. If you're interested in helping to contribute to our conversation about the Observatory for Future Health Workforces for Europe and Africa, please put your name in the chat and we'll be looping you in as we build on that conversation. But Maria, let me invite you to come in and share the experience from the EIB, about how you create specific earmarked bonds for delivery on mechanisms.
Thank you. Thank you very much. And thanks for having me here today. It's really a fantastic conversation to be part of. So let me tell you, the EIB has been issuing health bonds specifically since 2019. And what these are is bonds where we involve the capital markets in funding for health projects specifically. So we have a lot of green bonds that we have been issuing, but we are also issuing sustainability awareness bonds. And these for water projects, for example, for education, and we have issued them for biodiversity. I noticed this was mentioned, and we have issued them for health. What we're talking about is bonds that are directly linked to the use of the proceeds of that bond issuance for health projects. And here what we do is we use the EU sustainability taxonomy, and in particular, of course, with regard to SDG 3 on health. What is important, and you mentioned it, is that these have to be quality capital market instruments. It is essential that we apply best practices with regard to the use of proceeds, with regard to reporting, and with regard to an external independent review. So, okay, the EIB has been issuing them, but this is not enough. What is important is that there are more issuers of quality health bonds. And here, let me just tell you that the EIB, in cooperation with the European Commission, we are willing to provide technical assistance to reputable issuers of health bonds, and we could also work as anchor investors to create that confidence in the capital markets that is needed. And let me tell you what this is there for, because fine, so we gather these funds from the capital markets, but what do we use them for? And I noticed that MEP Zacharopoulou, she said, it is the time for action. And that's precisely what we need to be using these proceeds from the capital markets as an intermediary to reinforce the manufacturing capacity in Africa, for Africa, of vaccines, but also of treatments, of therapeutics, and of diagnostics. And for this, there is already a setup, a pool of financiers where there's the European Development Finance Institutions, the European Investment Bank, logically, but also the African Development Bank and the IFC and others. We are there to incentivize the investments and to de-risk them. We're talking about generally risky type of investments in pharmaceutical and biotech companies. And we can be there to provide the funds, but also to facilitate and provide de-risking. And let me tell you about the Team Europe initiative precisely about this, where we're working with the African Union and with the African CDC. We need to have an engagement locally and look at hubs in a number of countries, but also the whole value chain across the African continent. It is not only where the hubs are going to be, and there cannot be a hub in every country, but there will be an involvement and a participation in the value chain from many countries in Africa. And what we need to do is deliver results. The results might not be immediate because it will take some time for these manufacturing facilities to be in place, but we need to start building them now. And at the same time, we need to work on the demand side. By the demand side, what I mean is working with the African leaders and the communities to tackle the fragmentation of local markets. We need to consolidate demand. We need to have this pooling of demand that will make those private sector manufacturers of pharmaceutical and biotech products that will make them successful. And for this, there is a very important aspect of the regulatory, how the African Medicines Authority and the whole system also linking with the free trade agreement within Africa. So all of these aspects are extremely important. I'm very happy that the gender angle was already mentioned because it is essential in everything that has to do with health. And let me mention, just to finish, the digital angle. We need to be looking at harnessing the transformational effect of digital solutions. And this to trace vaccines and medicines across the supply chain, to have access to e-health, and for many other aspects. We need to work on the short term, on the medium, and on the long term. Maybe I stop here and I'll be happy to come back later. Thank you very much.
Maria, just before you go, I'm very interested. You talked about the different development banks that are coming together, and these are big institutional, multilateral donors. But really, and you talked about de-risking and acting as anchor investors for the private sector. We keep saying that there is a business case here for investing in health in Africa, that there is a huge demand for vaccines in Africa, a huge demand for medicines. The business case is clear. Are you, from your perspective, are you seeing the private sector ready and interested? To what extent is there a demand from the private sector that just your intervention to de-risk it will allow them to come in? Or is there still a long way to go before we can get some of the private capital that's out there and interested in investing in health, looking at Africa in a different way?
Yeah, no, I don't think it's a long way to go, but we do need to be convincing. So the private sector needs to know that they're going to have a business plan and that somebody's going to be buying their vaccines, or that somebody's going to be buying the health or the health service products that they're going to be providing. And let me be, specifically on manufacturing of vaccines. Today, the biggest the biggest purchasers of vaccines, it's Gavi, it's UNICEF, it's the UN system, and it is some countries. So if we do not have this pooling, this willingness of these entities to say, if you manufacture vaccines in Africa, I will buy them from you and I will distribute them. If we don't have this, then we cannot have a sustainable business model for this vaccine manufacturing. And let me give you another example. We're working together with the Gates Foundation on diagnostics and using private sector lab providers to do diagnostics in a number of countries in Africa. And what these private sector lab providers tell us is we need to make sure that we're going to get paid. So how do we make sure that the governments will then pay for each one of the blood tests or any of the other analyses that have to be done? And there, again, multilaterals like the EIB can come in, and the risk, we can provide a guarantee on the obligations of the government to pay on behalf of those that cannot pay themselves. So there will be some population that can pay, but for those that cannot afford it, the government will pay, and we can provide a guarantee on the government obligations. With this type of mechanisms, this is what I called de-risking, we can put in place a system that makes it attractive enough for the private sector to come to Africa. If we do this, they will come. The market is there, the population is there, and they will be willing to come. And let me just say as a final point with regard to research and research capacity, it is important that research happens in Africa because then it will prioritize the diseases that happen more often in Africa, tropical diseases and some others. So it is essential that it is happening in the African continent. And for this, we need to create this pull effect from the public sector.
Thank you for that. And again, I note in the chat, we've had a comment from our colleagues at AIM, who in our strategy group, highlighting the role of the mutual sector, the mutuals and the health insurance funds acting as buyers. You mentioned, Maria, that you can act as the guarantors that the governments would pay, but the health insurers and the mutuals are another mechanism of pooling risk and acting as, joint procurement. So I think there's lots of different options that we can pick up on that. We've had also a comment, thank you, from Dr. Eunice Brookman, who is a member of our strategy group and a former ambassador. Thank you for that, talking about the health workforce. And of course, legitimately, they're going to look for the best option for themselves. And until we've got, a better working conditions and status for them in Africa, they will always be tempted to go abroad for work. So this is a plea for health systems to be developed in Africa that provide decent terms and conditions. And again, we've got lots of good comments in the chat about the lessons that we can learn from HIV and previous pandemics about where the international community failed to respond effectively, but also how we have people who then stepped up, community groups came up, activism that developed new mechanisms for bringing down the cost of medicines and making it more accessible. So there's lots of really useful elements that have been in the chat, and we thank you for contributing on that. We've just got a few minutes left before I close down this session. I think it's been a really wonderful opportunity to invite a broader audience to engage with us on some of the conversations we're having within our health strategy group, and we welcome you engaging with us and participating. We've also had elements in the chat from members of the strategy group who've contributed, highlighted the importance of education and literacy. They've highlighted the role of a broader society in a health system that works for the population and with the population. As I said, we're going to be taking forward our conversation around a new paradigm of public health, looking at the observatory for the future health workforce, and we would very much welcome people who want to engage with us and to share with us, to put your comments in the chat. We're at the early parts of our conversation about how do we finance health effectively. There is an interest from the private sector. There are the multilaterals that are looking at de-risking. There is a huge amount of money that's being set aside because it's very clear that if you don't have a functioning health system with a strong primary care sector in a country in Africa where the continent has a huge potential for future pandemics, then no one is safe. So there is a return on investment for money from the global community, whether it's private money or it's sovereign money or it's development money. There is a return on investment that is good for a functioning health system in countries in Africa. So because that is clear, we need new financing mechanisms to allow that to happen. And we're going to be building on that conversation. I'd like to close our conversation by inviting our two co-chairs, Agnes and Gunilla, to share their last comments and reflections on this great conversation we've had for the last hour and a half. So could I invite Agnes and then Gunilla to close our conversation? Agnes, go ahead.
This was a great conversation, and what I like, the truth start to come up. And we know that there is a lot of goodwill, but now we need to politicize the goodwill, meaning there should be law, there should be regulation. And let me tell you, even if you say that the people will always go for the best option for themselves, the majority of health professionals in Africa are educated with the tax of poor Africans that are poor themselves. So there should be regulation like we have in football. Nothing more than that. Let's be simply like we do in sport. Payback. Liberty, I love it. Movement, I love it. But payback. Payback, if you take a doctor, pay is for his education and the damage you create for the country. Same for a nurse, a physiotherapist, etc. Second, Maria, I would like to be in touch with you out of this meeting because we all know that the president of South Africa has been nominated by African Union the champion of COVID. He has just created last week a commission. It's still not public, but a commission for supporting his work. And in that commission, there is a commission in charge of fundraising, creating mechanism system, and I'm already working on it. So we know that pulling the demand is easy. Somebody called Clinton, President Clinton, have done that for HIV. That's how we got all those access to treatment, because he went country by country and say, if I make it happen, how many will you buy? And he went with a list, a shopping list of countries to create the factories to do the IVs that are still saving life today. So pulling the demand is easy, is known. Private sector is there. I love the de-risking things because we need to put around the table public sector, private sector, and also the scientists from Africa that are working in Europe. But we need also to put those big pharma together and make them understand that it's losing money is a myth. Coca-Cola is patented. No country without a Coca-Cola farm. And every time somebody drink a Coca-Cola in Africa, Coca-Cola in America make business. They can do that for vaccine. We do vaccine in Africa, we inject African, and Pfizer and all the others are making money. So even the money issue is not an obstacle. Even the patent is not an obstacle because you can license the patent. So the problem is elsewhere. And we should continue to be honest and tell the truth.
Thank you for that, Agnes. Gunilla, would you like to say a few closing words?
Sure, Tamsin. I think, we really spoke about the financial impact of this pandemic, and of course also realize the socio-economic and also what this means for health systems. And we have learned from previous pandemics that the risk is that the world's attention will leave before the issue is solved. So I think what we have learned today, we have a very hard backdrop with now overfilled hospitals in Africa, with a surge in new cases. And at the same time, I sense so much of concrete positivism. And as you said, so many good suggestions on what we can take forward to make sure that politics matter, but it only matters in a partnership these days, because we have heard so much from civil society, from research, from media. So I think we are in a new era, and I feel very, very pleased that we had such a constructive and comprehensive discussion today. So thanks to all of you.
And I'm delighted I can see that we still have Kristalina Georgieva with us online. I mean, I'm delighted you're still here, and I hope you've had a chance to listen to that. Can I invite you to take the floor for the last 2 or 3 minutes to just tell us how you've heard some of this conversation? We've been talking about the changing relationship and how now is the moment before political attention goes elsewhere, because political attention is always attracted by the next challenge. And later this year, it will all be about climate and COP26. So how do we use this moment to represent real change?
Very, very interesting discussion. I was listening to all the voices, and I would take 3 lessons from what we have heard. The first one is that women are mobilized. I'm not sure you have done it on purpose, but there has been such a strong presence of women in the conversation today. And the world needs its women. We have to step up, and I'm glad we do. Good things will follow. Second, on a very serious note, it is our challenge to write on the soberness this pandemic has brought and do the right thing. And doing the right thing is to recognize that we cannot have a world that is drifting with the haves and have-nots being a trend that we cannot stop. We can stop it, and we can stop it for the benefit of everybody. Zeinab talked about the huge advantage of tapping into talent in Africa. For Africa, but also for the rest of the world. And that enlightened self-interest, we have to capture from the pandemic. Why? Because what we learned is, yes, we are interdependent. There is no way to break that bond that connects us, and that we cannot come out of the pandemic with one part of the world succeeding and the rest of the world stuck into it. To put it very simply, there is no such thing of being in the same boat, but being able to say, hey, your end of the boat is sinking, mine is not. So that recognition has to drive action. And 3, for me, for my institution, what I take from this is reach out, build alliances. We have put out this pandemic plan, $50 billion. It has 3 key parts. 1, vaccinate the world 40% by the end of this year, 60% by mid next year. And that is mobilized to deliver vaccines on that scale. 2, diversify production. Both in terms of regions, and obviously Africa has to be a production center, not just one that receives vaccines, but also in terms of quantities. We have to produce about 1 billion doses more than the world population requires. Why? Because we need it for boosters, and we need it because some of the vaccines would go to waste. Price tag, 8 billion, totally affordable. And 3, recognize that there is a lot to be done to help beyond vaccines. We need genomic surveillance. We need the oxygen and the PPEs when they are pressed, when we are pressed to deliver. So there is a pathway to succeed for this pandemic, and also to build the resilience of health systems for the future. But it is only possible to do if we recognize we are in this together and work together. And I'm taking my responsibility from this conversation to mobilize the financing that is necessary, amplify the voices of reason, on the basis of this unity of purpose that the meeting today has brought. And to my European friends, go Europe. It is now the time for Europe to step up and shine and recognize that we are one. I mean, Africa and Europe are so much one that thinking any other way is just kind of dumb. Huh? So thank you very much for bringing us together in this Town Hall Europe.
Thank you very much for a very strong and positive message at the end. You know, we don't have to live in a world where we drift apart, and some people have and others have not. We can make different political choices, and it's really important. You've highlighted the extreme value of having women at the table and how that's changing the political agenda to be more inclusive, more pragmatic, more constructive, and more planned in the way forward. That's certainly something that we are promoting within the Africa Europe Foundation. Thank you for everyone to joining us, and I hope you enjoyed getting insight into some of the conversations and the work that's happened inside the strategy group for health over the last 6 months. We look forward to engaging with you in the future. And this is just day one of a week of activities from the Africa Europe Foundation, where we're inviting you to join us for different parts of our conversation. On screen now, you can see some of the conversations we're going to have, some of the events. We look forward to you joining, sharing. You can use the Africa Europe Foundation hashtag to share your input. Thank you for spending time with us this morning, this afternoon, this evening, depending on where you are. Goodbye from Town Hall Europe in Brussels. Thank you.